Active surveillance is a rather revolutionary concept. The thought that you can monitor prostate cancer rather than treat prostate cancer. And this is, of course, a surprising development. Anything called cancer, one would assume, requires immediate and aggressive curative therapy. This anomaly now, where there's actually a subtype of prostate cancer, we call it low-risk prostate cancer, that never spreads and never causes harm, has only come to medical attention over the last 5 to 8 years. And it's causing quite a stir in the medical world now, because we have this huge industry that's been built up over the last 20 years to try and aggressively cure all forms of prostate cancer. So we've got different schools of thought now that are sort of at odds with each other. And there's a wealth of scientific proof that low-risk prostate cancer is safe to watch. But it's taking time for the doctors to learn about this and to accept it and to be willing to act on it. So it is estimated that somewhere between 30 and 40% of all men that are diagnosed with prostate cancer in the United States every year are eligible for active surveillance. That would be close to 100,000 men annually that could safely watch their prostate cancer rather than treat it. So it's important to know all this background about what's going on in the medical world, because people tend to get confusing messages from their physicians, and different doctors will have different viewpoints. So it's important to realize that this is here to stay, that it is a medical fact, that it is safe to watch prostate cancer, and that's the starting point. Following that, of course, there are different methods for monitoring. Some centers use regular biopsies, frequent PSA testing, and different types of thresholds for deciding who has the type of cancer that does need treatment. I won't go into that at this point because that's a complex area, but the first and most important take-home message is that this idea that it's safe to watch certain types of prostate cancer is an established medical fact, and some doctors, unfortunately, are still unaware of that.